I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist. I'm also a diplomate of the American Association of Integrative Medicine. I'm the author of this book, Growing Young. I'm the clinic director of a clinic in Mounds, Minnesota called Mounds Chiropractic. Today we're going to be talking about migraine headaches. Now, in our office, we focus and specialize on working with patients that suffer from migraine headaches and just chronic, even tension headaches. And I know that it's something that impacts people and can be a huge detriment to their lives. We have, for instance, one patient who was unable to continue doing high school. She had to discontinue high school and be homeschooled because of the severity of her headaches. And that's a devastating thing to hear. And so I have a real passion for helping patients that have been through the traditional methods and just haven't been able to find the answers that they need. And so that's what I'm here to share with you today is what makes our approach different, and hopefully give you some hope that we may be able to help you with the migraines that you're suffering with. Now, first of all, just in some background, the thing that makes our office so much different is that we take a very, very comprehensive approach, and we look at every patient, every migraine sufferer on both a neurologic level and a metabolic level. We don't try to treat your migraine. We don't try to treat one thing. My goal is to support you as the patient. My goal is to support both your neurologic system and your metabolic system and bring all the pieces back so that your body can be as healthy as possible. And when we do this, we have great success working with patients that suffer from these chronic headaches or migraines. We have a testimonial section on our website. Please feel free to listen to those testimonials. The patients can say it better than I can ever tell you, but they'll tell you their stories, and you'll be able to hear from their own mouths some of the things that they've seen change as a result of working with our care program. Now, where does this all begin? Well, the very first thing I'll tell you is that most patients that suffer with migraines have not had thorough lab testing done like it needs to be done. And so we do very, very comprehensive lab testing to help us find and dig into what is actually driving these headaches for you. And so the very first thing is a metabolic panel. We run a very thorough metabolic panel where we're basically going to look at you from head to toe for any signs of physiological dysfunction. Different markers that we look at. We have to look and see, do you have any type of underlying anemia? If you're anemic, you're literally robbing oxygen from the cells. Every cell needs oxygen for health, and your brain needs oxygen to survive. And so if you're anemic, you're not giving your body the amount of oxygen it needs. We have to look at blood sugar regulation. Again, glucose is also one of your cell's main fuels for health. And so if your blood sugar is not very tightly regulated in an optimal range, your cells, your brain are going to be starving for that fuel that it needs. We have to look at lipid panels. We look at inflammatory markers like homocysteine, fibrinogen, C-reactive protein. These inflammatory markers give us clues as far as the state of your immune system and how much inflammation you have in your tissues. And so we have to do a complete thyroid panel where we look at your thyroid. Okay, we look at thyroid antibodies where we're looking for different underlying autoimmune processes. And so with this comprehensive metabolic panel, literally we're going to cover you from head to toe, looking to see what different problems are developing in the system. And so this is a very, very important test to give us basically a background of what areas we need to support just to lay the foundation to build on. Now, in addition to this, we have to run sensitivity testing. Sensitivity testing is looking at different types of foods that the immune system can be reacting to. Now, you may be saying, I don't have any digestive complaints, I don't have symptoms. Your only symptom of a food sensitivity can be the migraine. It can be just the headache. It does not have to be that you get a lot of gut or digestive pain, and that's very important to understand. So looking at these types of food sensitivities for migraine sufferer is imperative. The main foods we look at dairy, we look at gluten, soy, yeast, egg, corn. These are all foods that can potentially trigger the immune system and cause reactions within your body that are creating inflammation in the brain and the other tissues, perpetuating these migraines. And so super important that we look at these food sensitivity tests. We run a blood panel to check that. In addition to looking at sensitivity testing, we also have to look at gut infections. Find out if there's other infections in the gut. why is it that we're focusing so much on the gut? Why do we care about these food sensitivities? Why do we care if there's infections in the gut? The reason for this is because 70% of your immune system is in your gut. And so what we find is that one of the main driving factors for many migraine sufferers is their immune system. You see, when your immune system is being inappropriately activated, it creates inflammatory cytokines, inflammatory reactions, which promote inflammatory changes in the brain and therefore causing headaches. And so we have to identify any type of inflammatory process that's driving inflammation. And so the food sensitivities can do that, but also underlying infections can do that as well. And so we look to find out, do you have any parasites, bacteria, fungal, yeast, overgrowths in the digestive system that could be perpetuating this chronic immune inflammatory response? In addition to this, we have to look at the adrenal stress index. Our adrenal stress index is looking at your cortisol levels at 4 different times throughout the day. Cortisol is very important, as cortisol is a marker that tells us a lot about why you may not be able to sleep through the night, why you might have insomnia, why you may be fatigued throughout the day. Okay, it also tells us things about weight loss and mood. So very, very important area to look, and the adrenal stress index allows us to take a look there. In addition to these, we have to look at your immune system. Okay, so like we talked about, 70% of the immune system is in the gut, but then we also want to look at what are called autoantibodies. These are looking for autoimmune reactions within the body. And it's not uncommon to find that many patients that suffer from chronic migraines have autoimmune reactions. And what that means is your immune system is actually targeting and attacking your own tissue. This can promote headaches, migraines, pain, light sensitivity, all of these things. And so with proper lab testing, we're able to identify what causative factors are really going on within your body. So we're able to come up with a supportive nutritional dietary plan of how to support you to unwind these physiological processes that have been started. And this is imperative to getting you back to being well again. On the second side of things, we also have to look at the neurologic system. And with migraine patients, this is extremely important. You know, it's very, very, I think most patients understand the concept that if you're suffering from migraine headaches, that this is a neurologic problem, that there's some sort of brain disorder. One of the first things that's done for patients that have chronic migraines and headaches is MRIs and CAT scans of the head, looking for tumors, aneurysms, and these types of things. And so, of course, you know, we want to rule those things out first. You know, if it's a tumor or an aneurysm, then I'm certainly not your guy to help you. And so we want to rule those things out. But once that's been ruled out, and we know that there's not hard pathology there in the form of an aneurysm or tumor or anything like that, then what we know is that we can still look for other underlying processes that are occurring in the brain that could be promoting these migraines. And that's what, as a chiropractic neurologist, what I focus on is looking for areas in the brain that aren't damaged due to a tumor, but are just not working as effectively as they could. And this can happen because of autoimmune reactions. This can happen because of food sensitivities. But some sort of process, trauma, that has damaged tissue in the brain and has caused your brain to not be working as effectively as it should. One common area in the brain that we find problems in with migraines is an area of the brain called the mesencephalon. The mesencephalon is your upper brainstem, and it's basically the top rung of your sympathetic nervous system. And so when the mesencephalon begins to overfire, it creates large fluctuations of blood flow into the brain. It creates a light sensitivity. It can create insomnia, anxiety. So again, many of these patterns we see in our migraine patients, and it can be a sign that this is the area of the brain that's not working well for you. Now, once we do the neurologic exam, we're going to be able to identify what areas of the neurologic system are not working, and then we develop a specific treatment protocol to help to rehab that. We refer to it as brain-based therapy. It's all very, very comfortable. It's non-invasive, but it allows us to basically rehab and exercise these weakened areas of the brain and bring balance back to that system. I don't want to be exhaustive today. You know, I just want to give you some basic background and show you how we take a different approach in working with migraine patients. So if you liked what you've heard today, I encourage you, please take the time, fill out the registration form on our website, and come into our office, and we'll find out if you're a good candidate for our care, if you're somebody that we can help. Now, what I'll encourage you to do is in closing, just think about a couple of things. How have these migraines affected your day-to-day life? What have they stolen from you? What have they prevented you from being able to do? Is it time? Have they prevented you from being able to do your job, from working? Has it prevented you from spending time with your family? How have these migraines or these chronic headaches affected your family? How have they affected your friends, your friendships, your loved ones? Okay, if these migraines are making a negative impact on your life, which I'm sure they are, otherwise you wouldn't be watching this video, then you need to make a change. What I can tell you is insanity is doing the same thing over and over again and expecting a different result. You need to make a change. That's what we're offering here. So we're offering you a different approach that I know can help you to completely reinvent your life. So I encourage you, take the time, explore our website, watch some of the testimonial videos, and if you find what I talked about today at all interesting, come into our office, let me hear your case, your story, and find out if you're going to be a good candidate for our care. I thank you so much for taking the time to watch this video, and God bless. Thank you.